snoring, sleep apnea, clenching, grinding, TMJ and face pain, headaches, asthma, tongue tie, thumb sucking. Chances are you suffer from one or more of these conditions, and I'm positive that it impacts the full potential of your life. Welcome to Myofunctional Pathways, the podcast, where we'll delve into all topics related to airway and myofunctional therapy. We help people find relief to problems that other treatments may not have helped with. Join us as we explore the ever-growing world of myofunctional therapy. We have one goal in mind, helping you to live your best life. We help you sleep and breathe deep. Hello, everybody. My name is Becca Rose. Welcome to the very first episode of Myofunctional Pathways, the podcast. I'm really excited. I'm really excited to have a space where I can come on and talk to you, and we can learn a little bit more about what it is that myofunctional therapy can do to help you with your symptoms. So let's first, let me take a moment to introduce myself. My name is Becca Rose. I have been in the dental world in some capacity or another since 2004. It's hard to believe it's been 20 years. Oh my goodness. So I've been a dental assistant, an oral surgery assistant. I've done claims and processing. In 2010, I got my licensure to be a dental hygienist. And then after just years of wear and tear, my body started wearing out. My neck hurts, my back, my shoulders, my knees, my hips, everything you can think of was hurting. So this was a really good time for me to start pivoting into a different career. So almost 3 years ago, I started my business, Myofunctional Pathways. And within the last 3 years, I've had an amazing opportunity to work with so many highly known professionals in this industry, mentors, just so many people have had such an amazing influence. And I'm really lucky that I've had those experiences because it's really shaped who I am as a myofunctional therapist and really elevates the level of care that I'm able to provide to my patients. So that's a great big thank you to everybody who's helped get me to where I am today. Okay, let's dive in. So what is myofunctional therapy? Well, it's a type of therapy that treats the muscles of the face, the mouth, the tongue. We teach those muscles to function properly. Think of it like having a personal trainer for your muscles, but we're working specifically in the muscles of your head and your neck and your throat and your tongue. That's the big one, okay? So what does it do? It helps improve your breathing, your swallowing, and speaking. And it can also help correct problems with your jaw alignment, and posture. Other things that we see improvements with are speech disorders, such as like lisping and stuttering. Sleep disorders, this is a really big one. Snoring, sleep apnea, TMJ pain, orthodontic relapse, difficulty with chewing or swallowing, mouth breathing, facial pain, and headaches. So typically, you will come in to have an evaluation, and during this appointment, we will check all kinds of things. We'll ask you to do all kinds of funny things with your face and your tongue, and basically what that's doing is telling me how you function, okay? We really need to address the airway. Really what myofunctional therapy is doing is addressing your airway. Can you breathe well through your nose? If you can't, then that's the first thing we need to address, okay? Because if you can't breathe through your nose and keep your mouth closed, nothing else is going to help with your symptoms. The next thing we do is really look at your tongue, because if there is something called a posterior tongue tie, then that can prevent the back part of your tongue from elevating and lifting up to the roof of the mouth. And the reason that that needs to happen is because if the tongue can't fit well against the roof of the mouth or can't create a suction, then it's going to be impossible to keep your mouth closed and you're not going to have a really good functional swallow, which is one of the end goals of myofunctional therapy. So let's talk about sleep for just a moment. So probably the most common thing that people come to see me for is sleep. They are exhausted. They can't sleep. They can't stay asleep. They need help and they need it now. They need it now because the benefits of sleep, well, let me rephrase that. The lack of sleep impacts every single part of your life. Your ability to concentrate, your ability to, just function. We all know how crappy we feel when we don't sleep good, right? And now if this has been going on for your whole life, you're likely very, I don't want to say irritable, but you're probably irritable. You're easy to, get cranky. I know I am, even if it's just been a night or two. I get really cranky really fast. And then, the lack of sleep, it doesn't just affect us, it affects our partners as well, and our family and our children. So if we're in a cranky mood all the time because we're not sleeping well, we're probably going to take it out on the people that are the closest to us. And those are the last people we want to take it out with, because they have to live with us and we have to live with them. And we want to have a harmonious, household. So snoring, all right, this is a really, really big one. It is not normal to snore. Let me say that again. Snoring is not normal. Snoring is your body's response. It's the sound your body makes when it is struggling to breathe. Did you hear that? Snoring is the sound your body makes when it is struggling to breathe. When we are snoring at night, there's so many things that could be happening. Is the tongue falling into the airway, causing blockage and causing some of those apneas to occur? When you breathe in too much air too quickly, the muscles can collapse. So think of like you're drinking out of a plastic water bottle and you keep drinking the water out and then you have nothing but air. And then once you suck out that air, the bottle collapses in on itself. That's pretty much what happens to your muscles when you are over breathing too much air, too much volume, too quickly. It causes those muscles to collapse in on themselves. And then you get that vibration of the back of your tongue and your soft palate and that snoring. And nothing is worse than when you hear a child snore, because a child should not be snoring. What is going on? Okay. So according to Patrick McEwen from the Buteco International Group, he says that approximately 50% of people, adults with sleep apnea, are non-obese. So we used to think that obesity was the biggest reason. Think of the stereotypical, Caucasian overweight male was the one who had sleep apnea. But now we're seeing this start to happen in very young, very fit, even young women, okay? So why is a 19-year-old, a 25-year-old being diagnosed with sleep apnea? Well, there's a lot of reasons, and we can do a whole nother segment on that down the road. But today, my intention is to just bring some awareness to some of the things that we do during a myofunctional program. We help to strengthen these muscles to reduce your snoring. And I will tell you that most people say what they go through is life changing. That's not me talking. That's clients that say that. I wish I knew about myofunctional therapy 5 years ago, 30 years ago. My oldest patient right now is 73 years old. I've got quite a few that are in their 70s and 60s because they don't sleep like they used to, or they don't swallow like they used to. So let's lead that into the next topic here, swallowing. As a dental hygienist, I work on the part of swallowing that happens within the mouth. Okay. So the therapy works on the tongue and the soft palate. And those things have to work together for the swallow to be initiated within the oral cavity. Just like every other muscle in our body, our tongue muscles, our soft palate, our throat muscles, they start to lose tone and function as we age. And so oftentimes adults will say, Yeah, I just kind of randomly choke on my saliva, or, I take a small drink of water and it just goes down the wrong pipe, or it's getting harder to swallow pills and I don't understand what's going on. And oftentimes, when we can strengthen those muscles, teach them how to work correctly, get the function back, a lot of times those issues resolve. Now, disclaimer here. A speech pathologist is someone who is trained to work in specific swallowing dysfunctions and disorders. So if there's ever like a true feeding problem or um, a true, what the heck? Here's the magic of recording live here. I just had my big exercise ball fall off my exercise bike and bounce all over the floor. So anyway, don't mind me as I regroup here. If there was really like significant swallowing problems, then you would be referred to the appropriate person to help you with that, to help get a diagnosis and then have the correct treatment. But with things that just don't function like they used to, like, choking on your saliva, oftentimes with strengthening the muscles in the tongue, in the mouth, in the oral cavity, we can get that function back so that you feel more confident and you're not always worried about, am I going to be able to swallow this pill, or am I just going to start coughing because I choke on my saliva at random moments, like when I'm hanging out with people or coworkers or colleagues, okay? So we don't want that for you. So, okay, the next big thing we look at is tongue tie. So there's something called a posterior tongue tie. And this is a lot different than when you see a baby that has that really tight little string on the very tip of their tongue, and they literally can't move their tongue. So this is a different kind of tongue tie. If you ever go to a dentist or a pediatrician or a doctor or an ENT and you say, I think I have a tongue tie, and they look at you and they say, stick your tongue out. Can you lick an ice cream cone? Do you have any speech problems? And you say no, then they're going to tell you, nope, you don't have a tongue tie. The problem is that they're talking about an anterior tongue tie, and we're talking about a posterior tongue tie. So if you really suspect that you have a tongue tie and your provider says, no, you're good, ask them if they're talking about a posterior tongue tie or an anterior tongue tie, because they are completely different. Okay, I can't look at your tongue tie and say that you have a tongue tie. I look at your function. So when we do an evaluation for you, you come in and I assess all your oral function. I ask you to do all kinds of crazy things with your mouth and your tongue. And I ask you to swallow and chew food and do all kinds of things because I want to see your function. And then based on that, I'm able to put you into a grading category based on validated protocols. And we put you into a class of tongue tie, a classification. So there's 1, 2, 3, and 4, with 4 being the worst. So that's kind of what happens next. When you have suspicion of snoring, sleep apnea, clenching, grinding your teeth, you have TMJ problems, headaches, facial pain, you're breathing through your mouth all the time, you're stuffed up all the time, maybe you get frequent colds, lots of anxiety. The list of OMDs, or what we call them, are oral myofunctional disorders, okay, OMDs. The list is so long, I could not name everything off. But like I said, the most common are sleeping, snoring, sleep apnea, TMJ, clenching, grinding, facial pain, headaches, and everything along those lines. So if you need a place to start, here's what we do. Visit our website, www.myofunctionalpathways.com. On the website, there is a button that says free discovery call. So let's set up a free virtual Zoom call so that we can meet face to face through the computer and talk about what it is that we do, how I'm going to help you, okay? And then from there, we would set up your evaluation and give you the breakdown of what we're observing and what we think is going to be the best treatment plan for you. So thanks again. This is my first, go around at doing this podcast thing. So it's probably not amazing, but thanks for sticking with me. And I will, just like with everything else, as you do things, you get better, right? So Thanks. Send your feedback. Let me know if you have questions. You can scan this QR code on the screen here. It will take you right to the website. But again, www.myofunctionalpathways.com. And let's have a conversation and see how I can help you. Thanks for listening. See you next time.